one thing that's coming back, some of the old-time remedies are coming back. The bit about putting someone, let's say the child, into a bath if they have a high fever, and then putting them in, while they're damp, in flannel pajamas, then in bed with 3 or 4 blankets, and you get the heat, the body to generate more heat, and the immune system activates at 101 or 102. So we're almost hurting ourselves. You have a 99-degree fever and you take Tylenol. You're pushing it down. You're not letting your immune system work. So
well, it's similar to the runny nose, right?
Yeah.
You know, our body produces fever for a reason. It's to kill off the things you don't want there. Now, you know, as long as it's not over 104 or something like that. You know, if it's excessively high, but it can have its function.
Suppression really isn't the best medicine.
Not always.
Moving along, some of the things that the old-time remedies that are really coming back and they work. I know we sometimes recommend people use a neti pot properly to help flush. That's very, very good. Some of the essential oils can help open up the head, or if you're a little bit agitated from being sick, a drop of lavender can be very, very calming. Chamomile tea can be very, very soothing. And one thing I'd like to discuss is using a humidifier properly. Because what happens this time of year, especially in New England, we all have our heat on, even if we're keeping it low to keep our expense down, but the air can get down to, the humidity can get down to 15 to 20%, which is almost like in a desert. And one of our defense mechanisms of the upper respiratory system is keeping that tissue moist and a nice layer of mucus on there. And all night long in that dry air, we're drying it out, which is taking away our first line of defense against viruses. So having a humidifier running, one, you'll sleep better, you won't be as congested, but very healthy for you. But you have to make sure you keep it clean.
Exactly.
And
you don't want mold to grow in there.
You have water sitting there, so you don't want to be putting mold and bacteria. What sort of things do you recommend to some of your clients?
Well, thinking about kids, so elderberry is good. You know, elderberry helps to prevent viruses from replicating, and you can get it in a syrup. It's kind of sweet, so sometimes finding something that kids will take can be helpful. There's another homeopathic, it's a pelargonium, and that's actually been used in clinical trials. They did a bunch of studies, and it shortens duration of infections like bronchitis, sinusitis, and things like that. So that's something that you can find, which can be really helpful. Let's see, vitamin D, you know, even making sure your vitamin D level is at a good level, so somewhere between maybe 50 to 80 for a vitamin D level. So especially in the wintertime, New England, no sun, you know, making sure
and
that
that's something
you're
that's
keeping
very interesting. We weren't watching vitamin D levels for years, and now all of a sudden we're checking and we're finding a lot of the population is very low in vitamin D. And that's not only helpful for immune system, but bone density.
Sure. And people probably need, I mean, in wintertime, I'm finding a lot of people need even 5,000 international units of vitamin D a day, you know.
And it's a very easy, inexpensive lab test, and so people, you know, we recommend when they go for their physical to just ask to have their D level checked once in a while, especially this time of year. And then in the summertime, we're not going out and cooking in the sun for hours. We're wearing long sleeves. Everyone, their moisturizers all have sunscreen in them. So vitamin, you know, the sun is unhealthy, but it does have some healthy benefits, and we need to make sure we're getting...
Let's get your 10 minutes.
Yeah. You have any other tips on how to...
Oh, you're talking about, you know, old-time remedies. I can remember, you know, what my grandmother did. You have some tea, put some honey in there and lemon in there, you know. Honey is really good for cough. Probably the heat from the tea is good to, you know, help moisturize the respiratory tract. Lemon, your vitamin C, so, you know, grandma
And also
knew.
you have to take 10 minutes just to slow down and make the cup of tea and sit and enjoy it.
Probably half of
and we really, you'll probably find if you take a few minutes every now and then just to unwind and decompress, you'll get a lot more done during the day and stay a lot healthier. Also, when we're going back to the food, making the healthy choices, but we're also rushed. We're not, I remember growing up, either my grandmother or my mother, something was always cooking for dinner. Now, a lot of people, they're not cooking. You stop and get pre-cooked food. Then you bring it home and throw it in the microwave.
Right.
And that destroys the enzymes and the
Right.
good bacteria and a lot of the nutrients. So we're really not giving our body what it needs. So it's no wonder colds and flu are a real
Right.
problem.
And in the wintertime, you know, the yellow-orange vegetables have
Yeah.
more vitamin A. So vitamin A is really good for the respiratory tract and immune system.
Yeah.
Another good thing. Garlic is good, you know,
Yep.
ginger.
Eating, cooking with it.
Yeah.
Ginger, when you're sick and you're not your stomach's a little upset, a hot cup of ginger tea and just sip it is very, very helpful. And it's one of the warming herbs. This time of
Right.
year, we could all use a
That's
little
right.
more heat, which is very good. All right. So I think we came up with some good ideas for people. The clients and people should really talk to their doctors, their practitioners, their pharmacists, because there are some wonderful things that you can do to help the body, both prevention and when you start getting sick. You don't have to take something that's going to interfere with your medication or that's going to make you sleepy or keep you up at night. You know, that's the worst thing. You take one of the decongestants that speeds you up and then you don't get a good night's sleep, which lowers your immune system even further. So, you know, be careful when you pick up something on the shelf and really ask questions. And if the person doesn't know the answer, you should look for a new place to get your information and your products. And I guess lastly, this is a good time of the year for some nice hearty soups. And you know, the root vegetables, all the bright, bright colors, make a nice thick soup and have that for lunch. You know, real
Right.
quick and easy to heat it up. It only takes, in a pot, not the microwave, a couple minutes, and really take care of yourself. Dr. Byrne, thank you so much for joining us today and for your expertise and time. And I think you gave our audience a lot of good information. Hopefully we'll be nice and healthy this winter. And I want to thank you all very much for tuning in and joining us. And please join us next month for another edition of Staying Healthy Naturally.